I grew up in New York City. I was born to a father who was on one side of the camera as a producer and a director. One of my father's famous commercials was this old Prel commercial where he got the idea of showing how thick it is by putting a pearl into the bottle. And a pearl slowly dropped into the bottle. They won a Clio for that. And my mother was on the other side of the camera. She was a weather person, and she was a spokesperson for Arnold Bread. And when I was roughly 10, my father needed a kid for a gravy train dog food commercial for a voiceover, and I did it. I have two brothers, and arguably the most famous commercial of all time is the Mean Joe Green Coke commercial. A little kid hands Mean Joe the Coke, and in exchange, the kid gets thrown Mean Joe Green's jersey. My little brother was the kid in that commercial. I grew up in this acting environment on both sides of the camera where you have to bring passion. Instead of that passion being on the screen, it's fighting and advocating for cancer.
Cancer treatment is being delayed, changed, and in cases even stopped every day in the United States. The lives of cancer patients hang in the balance.
Most institutions have had to institute a review board, often with an ethics committee, to develop harrowing plans of how to ration chemotherapy drugs, most of which are generic drugs that have been available for 30 years or more. How do you decide who should be given the chance to live?
I think this is a crisis. It's a national crisis. And we need to come together, put all politics aside, and say, how can we get these drugs safely distributed through the proper channels?
I'm Ted Okon, the Executive Director of the Community Oncology Alliance. 20 years ago, COA upset what was the status quo for advocating for cancer care in Washington, D.C. I was associated with a large cancer clinic. A former colleague gave us a heads up that the government was planning to radically change how Medicare paid for cancer care. The Medicare Modernization Act of 2003 was a fundamental lowering of what they would pay for cancer care. That put community practices in danger. Practices would go out of business, oncologists would retire, and practices would merge into large hospital systems. If a patient can't pay for their treatment, that's life and death. You can't pay, you can't get that treatment, and no one will give you that treatment unless you can pay. That's life and death. And that lit the fuse for COA. We brought all members of the cancer community together. We needed to form some kind of association, and the name that came out was the Community Oncology Alliance. We formed it as a nonprofit, and we were off to the advocacy races.
Not only is cancer care facing massive cuts, but there are drug shortages, and we have low cost but critical generic drugs that are in short supply. We're going to be talking.
The first time I testified in front of Congress, I was to testify on drug shortages. Typically, you're called by one party. I was called as a witness by the Republicans.
The drug shortage crisis in America has all the makings of a national crisis. Doctors are frustrated, patients and loved ones are worried, lives are truly in the balance.
I was really nervous. Anyone who says they are not nervous in testifying to Congress is just lying.
Whatever we do, we have to put the politics aside right away. We have to get in a room and come up with some solutions, because this is really a crisis.
If you believe that pricing is the cause here, how do you...
What became apparent is not both parties agree of what was causing these drug shortages. So what do you have to do? You have to educate. How do you educate? You put together data.
Here's the kicker. In pure financial terms, we did this calculation because there's great data out there.
It's going to cost them a net of $1.5 billion a year. I mean, this is the way the government works, and we call this up on the Hill the unintended consequences of public policy. I get off the Hill and I say, this is screwy. My mother would bring me in front of the camera during her weather reports. I grew up in that environment, and it's an environment where you can't be bashful. This is a crisis now. It's a real crisis. It's not a made-up crisis, and we are endangering the world's best cancer care delivery system. We early on realized the press was very, very important. You have to build up credibility. You've got to put yourself out there. Members of Congress live and die by the press.
Our message today is, Mr. President, we need to build on the excellent delivery of cancer care that we've developed in this country. But what we also have to do is we have to fix what's broken.
Well, they were in the heat. It was a light moment, though, about a serious matter. Doctors, nurses, and patients broke out into dance.
The drug price is an issue. It has to be addressed. I'm saying it, and I say it with two representatives from drug companies here. It's a problem. There was this belief that oncologists were prescribing expensive drugs because they made a lot of money from these expensive drugs. So what we had to do was debunk that. Independent community oncology is physician-run practices delivering the highest quality, most affordable cancer care to patients in their own communities. Physicians understand cancer patients. You want the patient to be close to family members and have that support when you have multiple cycles of chemotherapy or radiation, whatever it may be. Having that local care is absolutely essential. That's what community oncology is all about. You know, you really have to be careful with the media and with the press, because in a lot of cases, they have a predefined story.
Cancer clinics across the country are turning away thousands of Medicare patients, thousands. Tell me, Ted, why are these cancer centers turning away Medicare patients?
Well, the problem is, Greta, is that the sequester cut Medicare across the board, and
you
it's
know
a
what,
real
Ted,
dilemma.
Ted, you know what? It's just mean. It's mean and selfish. And all these politicians.
When you do a live interview, sometimes the press will veer off or try to take you down a road that may be a dead end. You get the interviewer who basically interrupts you. But you have to stay objective as possible. You have to get them back.
I've heard from numerous members of Congress to say, what can I do? What can I do? And I said, we
come back to town.
Come back to town. Good.
Stop.
You have to do what a good politician does, is not necessarily answering their question, but answering the question that you wanted them to ask in the first place.
Well, we shouldn't put politics, we shouldn't put cancer patients in the way of politics. And that's the problem that's happening right now.
So you learn by experience. When you're in front of Congress, you're speaking for every cancer patient out there. And you're fighting misperceptions, a lack of knowledge, and you're fighting the politics. So sometimes you're not exactly sure of how a member of Congress was going to react. Recent changes to the state of New York's Medicaid reimbursement policy for patients duly eligible for Medicare and Medicaid will hurt community oncology practices and the patients with cancer they serve. It is Medicaid that is supposed to cover the 20% coinsurance. That is the issue. Community oncology practices simply cannot absorb additional payment cuts. They either have to send patients to hospitals or eventually close or merge into large hospital systems, in which case all patients end up being billed under the more expensive hospital setting. There's one thing I never lose, is hope. Tragically, it is the most vulnerable patients, seniors and those with disabilities, who get caught in the policy crosshairs.
The Medicaid reimbursement policy for Medicaid, Medicare, was that implemented, first of all?
I believe, yes, it has been implemented.
Okay, well, that was a bad idea. These are medical practices. And you know what happens when they don't make money and they lose money? They don't take the patients anymore. And guess where they go? Hospitals, which is certainly not the best setting for someone going through chemotherapy. And secondly, it's much more expensive.
That really took us to a whole new level to have an impact in Washington, D.C., to allow me, our lobbying team, and our entire team to have even more of an impact and have even more credibility.
So we understand the issue. We're going to try to fight for it here and make sure that it does not remain, because we do believe, as Senator DeFrancisco said, it's counterproductive.
It's just short-sighted foolishness and long-term big damage.
So where are we now? We've really proven the value of independent community oncology and being the real backbone of cancer care in this country. It's building up that credibility and having members of Congress, the press, and the White House and others literally come to you because you know what you're talking about. You're talking about it based on fact and with passion. I think when you sort of combine running a clinical research network in oncology, my wife's 10 years as an oncology nurse, the professional and the personal stories that we've all encountered, it just gives you an empathy like never before. I may be sort of the junior actor or spokesperson in my family, given the credentials of my family, but I like to think that my mom has rubbed off on me a lot in terms of giving me the passion, the wherewithal, and the ability to stand in front of a camera or an audience of people, or even testifying to Congress and saying what I believe in. I believe in independent, physician-driven community oncology, and I do this because it's the right thing to do.